So then, Dr. Shah, the heart, it can be resilient, but it cannot be abused.
Absolutely, Gary. Absolutely. When we look at the normal circulation, normal blood flow in the heart, heart has three main arteries, and the job of the arteries are to bring blood to the muscle cells, and it brings nutrients, oxygen. So, like any other cell in the body, the heart muscle cell will continue to function. And as we all know, just like in the engine in the car, you can't live without the heart or the brain. God has given us only one heart, so we need to protect that heart. So let's look into how the heart gets in trouble. The major reason in our country heart gets in trouble is heart attack. And many of my patients and many of our audience don't even realize that the plaque buildup starts as early as age 20. Again, plaque buildup in the arteries of the heart starts at age 20. So, is it a surprise to doctors? No, we always knew that. But somehow, we were not able to pass that information to our patients. So many times, I will see a patient who comes and sees me after what the plaque has done to their heart, not when the plaque starts building. So let's talk about plaque. When a person has risk factors, for example, diabetes, high blood pressure, cholesterol, if a person smokes, certain genetic factors, if these risk factors are there, particularly in combination, the wall of the artery will start building fatty streaks. Essentially, fat gets deposited in the wall of the artery. And like I said, it starts as early as age 20 in a person who has many risk factors at a younger age. Our country, the diabetes is on the rise. I see so many young people because of obesity, diabetes is coming in. And in diabetic patients, this fat buildup in the wall of the heart starts as early again as age 20. So what should we do about it? Let's look at the plaque first. The plaque is mostly comprised of fat, but it also has some scar tissue in there. And as we get older, the plaque starts growing 20%, 40%, 50%. And because the opening is only about 50%, the blood can be pushed through. But when the blockage is about 70, 80%, the blood cannot be pushed through that blockage, and heart muscle cells start suffering. And that's when a person will start getting chest pain we call angina. Now the catch here is that many people, particularly female and diabetics, they may or may not get chest pain when they have heart blockage. For example, many times in female, they will feel as if their stomach is upset. They will feel as if they are just getting tired. So if a person is getting tired excessively, and if there is no reason, and if a person has enough of a risk factors, it's heart blockage until proven otherwise. So watch out, because if you just wait for the chest pain as a sign of heart blockage, you will miss out about 20 to 25% of heart attacks. So let's just watch any symptom which come close to the heart. So my advice and my kind of recommendations to all my patients and our audience, that if any symptoms comes in your chest or back, which comes on exertion and goes away within 3 minutes of stopping the exertion, think of heart. Think of heart. So let's go back to the plaque again. So as a plaque is growing, if a plaque is 80%, I like it. If a plaque is 80%, I like it. And patients say, well, but plaque is 80%. And it's almost a paradoxic. It's almost like a kind of a opposite thinking. Because when the plaque is 80%, the heart muscle cell is suffering. And like I always say, nature always calls out for help. So heart muscle cell will give you pain. Just like when your knee is inflamed, it hurts. So you don't walk for a few days. Same way, when heart muscle cells are suffering because of the 80% blockage, you will get chest pain. You will get short of breath. And our brain is smart enough to pick up those signals. So you will come and see me. So actually, technically, I prefer, in almost like in a paradoxic, almost like in a kind of an intriguing way, that 80% blockage I prefer. Many patients get very, very surprised and amazed. What are you telling, doc? I mean, 80% blockage, that's bad. I say, yes, it's bad. But I know that bad actor because it gives you a warning and you come and see me. And then we know how to take care of that 80% bad actor. So let's see where I'm taking you now, Gary. It's the 50% blockage, which is a bad actor in disguise. So 50% blockage. When it's inflamed and when it cracks, we call plaque rupture. Now, the nature hasn't given you any signals because it was only 50% blockage. You were doing your business, no chest pain, no symptoms. Now, that 50% plaque ruptures, and in an instant, a clot forms at that plaque site. And now the plaque is 100% instantly, or the lumen or the opening in that artery is closed up instantly. And that's when body gets surprised, the heart gets surprised. And now you're having heart attack. So we have enough of a proof now, medical proof, where we almost think a person who has an 80% blockage probably will be caught more often by physicians than a person who has a 50% blockage. So what to do? Because how do you know you have a 50% blockage? Because you're not having any symptoms. You have to know your risk factors first. Because, for example, if a person has diabetes, we already know they have plaque buildup. And even if they have a plaque buildup of 30 or 40%, they have to be careful because they may not get any symptoms, but suddenly a plaque rupture. And I want all of our audience to remember one term, plaque rupture. It's not the plaque which bothers me or bothers our patients. It's the plaque rupture. Again, the plaque rupture. So prevent the plaque rupture. So what can we do? Lower the cholesterol. Take a baby aspirin if it's safe to take. Ask your doctor to make sure you safely can take baby aspirin. What does baby aspirin do? When the plaque rupture, a clot starts forming, and baby aspirin will prevent that clot growing. So all male above age 40 and all female after their menopause should be on baby aspirin if it's cleared by their primary care physician. So let's repeat what we just said. Plaque builds, plaque keeps growing. Fortunately, as plaque grows, person will get chest pain or shortness of breath and will come and see a doctor. Plaque is fixed, move on. But if you have a 50% plaque, if it ruptures very suddenly or breaks very suddenly, you get a surprise, you get a heart attack. So the way I put it is, let's get that plaque stable. If a plaque is getting inflamed, let's make it stable. How do you do that again? Control cholesterol, take baby aspirin, control your blood pressure. If you smoke, quit smoking because smoking makes plaque inflame. If you have diabetes, control your sugar because uncontrolled sugar make plaque inflame. If you are going through some rough hardship in life, learn how to meditate. Do some simple exercise. Walking 20 minutes, Gary. Walking 20 minutes make plaque stable so plaque doesn't rupture. These are the things readily available to you today. You can pick up your baby aspirin today. All of us. You can start walking 20 minutes today. You can start doing meditation in between your shows for 3 minutes. All those things makes plaque stable. And that's what I'm here for. I think we have a lot of tools. Like I always say, God gives us a lot of abilities. We have a lot of tools right at our disposal. Starting now, you can use it today. And that's what I say. Let's work together, not just as a physician, not just as patients, but all the business owners, all the radio stations. Because the way I personally feel, Gary, that as a business owner, you have a responsibility because your employees are like your family. If they are happy, if they're healthy, they will only grow your business. So I ask all the businesses to take personal responsibility as owner that have the vision, have the leadership to make their employee healthy. And I can tell you, employee will give them back 100%, if not 1,000%. They'll be more creative. They'll be more friendly. They will have a better customer service. They will smile all the time, and they will not call in sick. So let's do it together.